All right, so this is our 𝗥𝗢𝗕𝗧𝗦 laser treatment. Step one, we start with microneedling with radio frequency. You can see I've only done the laser portion on our forehead. The rest of our face is red from that RF microneedling. That has 64 gold-plated pins, and around each one of those pins, it emits radio frequency. So how contract the skin more, tighten the skin. The microneedling helps with firming, tightening, any kind of scars, fine lines, wrinkles, just overall, just kind of gives it a little reboot. With that, you're basically red for 2 hours, then you can wear makeup the next day. That portion doesn't require much downtime at all. This is the second phase of our fountain view. This is laser resurfacing. So this is fractional CO2 laser. So the little white spots that you see is fractioning. So I'm leaving behind some healthy tissue and I'm damaging some tissue. The damaged tissue is going to actually help rejuvenate and repair the skin. So it's going to help build more collagen, build more elastin, to resurface that outermost layer of skin. I can adjust my settings based off the patient's goals. So we can do this super light with basically not much downtime at all, or we can go very aggressive and have up to 10 days worth of redness and swelling and healing, but results for just next level. In order to do this treatment, you numb for about an hour before, but pain itself is pretty tolerable with the topical numbing. If you're still uncomfortable in the treatment itself, we can also do extra numbing injections as well to help with comfort. Now, for our fancy add-ons, we used to just offer PRF, which is platelet-rich fibrin. We get that from drawing your blood, spinning it down, collecting the growth factors, and then sprinkling that back on top of the skin. And remember, with the microneedle, I have the little channel, so it goes deep down into the skin. Now, with that, the problem is your body has to give me the healthy growth factors. Sometimes I'm not testing it, so I can't really prove how much growth factors it's giving me. We have fancy new upgrade options. Option number one for our best upgrade options is called PDGF-BB. That's our body's strongest growth factor, and we purify it. We made it in the lab, we purified it, and we're applying it topical. This will help patients recover a whole lot quicker, build more collagen, build more elastin, just help slow with minimal downtime. So if you normally take, let's say, 3 days to recover, you might be taking half them at a time. So we put that on topically, and then you go about your business. If you like, that sounds great, but I don't want to be that fancy, I want to scale back just a little bit, then we have our PDRN booster bundle, which is 𝗥𝗢𝗕𝗧𝗦𝗧𝗛𝗘𝗧𝗏. It's a fragment of DNA from salmon to help the body recover. Why salmon? Salmon's super close to human DNA, so your body recognizes it as the same. So it's going to help our body recover quicker. Is it as potent as the PDGF? No, but it's still an upgrade compared to just plain PRF. We do an in-office booster. We send you home with a PDRN mask, and then you have another booster at home if you pick that upgrade option. So you don't have to stress about which one's the best for you. We can cover that in your treatment, but that's just more options for you. This is about medium settings that I'm doing on her. She'll have about 5-ish days worth of redness, swelling, irritation, healing. If I get aggressive under the eyes, then she'll have some puffiness around the eyes. Totally normal. I really like to do this in a series if I'm trying to correct. So once a month for 3 treatments. If I'm just trying to maintain, if I already hit my goals, then we'll do a single once a year. This is kind of our fountain view behind the scenes.